Good afternoon, everyone, and welcome to today's news conference regarding the winter plan for returning to schools and child care facilities in the new year, and an update on the COVID-19 situation in New Brunswick. Bon après-midi tout le monde et bienvenue à cette conférence de presse portant sur le plan d'action pour l'hiver en ce qui a le retrait au retour à l'école et en garderie pour la nouvelle année et une mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today in the following order: the Honorable Dominic Cardy, Minister of Education and Early Childhood Development, and the Honorable Dorothy Shephard, Minister of Health. Les porte-paroles aujourd'hui dans l'ordre suivant sont l'Honorable Dominic Cardy, Ministre de l'Éducation et du Développement de la Petite Enfance, et l'Honorable Dorothy Shephard, Ministre de la Santé. Minister Cardy.
Thank you. Good afternoon, everyone. Bon après-midi, tout le monde. So a few weeks ago, as everyone I think is aware, Public Health announced the winter plan, which aims at managing the risks of COVID-19 through the coming months. As I've had the chance to say many times over the past 2 years, the Department of Education and Early Childhood Development works closely with Public Health, and we're always evaluating our plans, making sure they're up to date, reflect the latest information and science, and align with public health guidance. Today, as we face many unknown factors in light of the Omicron variant, we have once again reviewed our approach and guidelines to ensure they're able to address this rapidly evolving situation. Ensemble, nous avons élaboré des plans pour l'hiver pour les écoles et pour les garderies éducatives qui visent à garder nos enfants en bonne santé, en sécurité et à leur permettre d'apprendre en personne autant que possible pendant les mois d'hiver. Comme pour le plan pour l'hiver gouvernemental, nos plans offrent aux élèves et aux enfants, ainsi qu'au personnel scolaire et du secteur d'éducation et de la petite enfance, des directives sur ce à quoi ils peuvent attendre pendant les niveaux d'alerte 1, 2 et 3. As I've said since the early days of this pandemic, we know that we are going to continue to see cases in schools and in early learning facilities. This is about managing risks and adding layers of protection whenever possible. Dealing with COVID is ultimately making difficult choices, and often choices where neither are ideal, but simply choosing the least worst outcome. Ces plans sont axés sur les mesures dont nous savons être efficaces. La vaccination, les tests rapides, la distanciation physique, le port de masque, de bonnes pratiques d'hygiène, le nettoyage et la désinfection, et surtout de rester à la maison et de se faire tester quand on est malade. I cannot emphasize enough the importance of children, students, and staff self-screening every day before they leave home. If you are sick, stay home, please. Get tested, please. We're going to continue to provide in-person learning for all ages through any public health alert level, although at level 3, exceptions may be made on a case-by-case basis in consultation with public health. This applies to early learning and childcare facilities as well. So if public health say that we need to close a school, we will do that. But this is a plan of how we keep schools open and safe. Our rapid testing program for schools is going to be expanded. Anytime a case is confirmed in a school, all students in a K-8 school, unvaccinated students in a high school, as well as all close contacts throughout the system will be required to rapid test daily, regardless of their vaccination status. Regular rapid testing may also be required at schools and communities experiencing severe outbreaks in level 2 or 3, even if a case hasn't been confirmed at that school. As with all of our responses, this is going to be based on public health risk assessments for a school, for a community, or even for a region. Les élèves de la maternelle à la 8e année seront à nouveau regroupés en classe et ce groupe devront maintenir une distance de 2 mètres entre eux à tout moment. La distanciation physique n'est pas requise au sein du même groupe de classe. À l'intérieur des bâtiments, les élèves et le personnel de l'école continueront à porter des masques tout au long de la journée, sauf s'ils sont assis pour manger ou boire. On school property, high school students will be required to wear masks outdoors. For K-8 schools, masks can be removed if physical distancing between classes can be maintained. If 2-meter distancing can't be maintained between classes, then masks must be worn outdoors as well. Masks will continue to be required for phys ed classes and during music classes, unless you're playing wind instruments, in which case increased distancing is going to be required. Les instruments de musique à vent pourront seulement être utilisés en niveau d'alerte 1 pour les élèves de la 7e à la 12e année. Le chant et l'utilisation d'instruments à vent seront également limités à des blocs de 30 minutes. Les cours de musique et d'éducation physique se dérouleront également à l'extérieur lorsque c'est possible. As far as extracurricular activities, clubs, and sports, they are permitted at level 1, where we currently are, and spectators will be allowed under the rules defined in the mandatory order. All students 12 and older must be vaccinated in order to participate, and masking will be required for all ages. Field trips in level 1 will be permitted following grade level appropriate restrictions and vaccination requirements. At level 2, sports will be limited to skills and drills for those 12 and older who are vaccinated. Spectators will be limited to 50% capacity, and extracurricular and sports is paused for those under 12. Level 3, no sports, no extracurricular activities. Visitors to schools are going to continue to be limited, and virtual events are encouraged to the greatest extent possible. Les directives actuelles concernant l'utilisation des écoles par la communauté restent en vigueur, sauf si des modifications sont apportées à l'arrêté obligatoire. Dans ce cas, les écoles devront respecter l'arrêté qui s'applique. Au cours de la prochaine semaine et demie, les mesures suivantes demeurent également en place. La pause des vacances pour les élèves de la maternelle à la 6e année commencera le vendredi 17 décembre après l'école. Les sports et les activités parascolaires pour les élèves de la maternelle à la 6e année ne seront pas autorisés, et ceux de la 7e à la 12e année seront limités aux habilités et aux exercices. De plus, la dernière journée d'apprentissage sera le 21 décembre pour les élèves de la 7 et 8e année. Les élèves de la 9 à la 12e année commenceront leurs vacances à midi le 23 décembre, tel nous avons déjà communiqué aux parents. Regarding cafeterias, assemblies, and concerts, including Christmas concerts, venues are limited to 50% of their regular capacity effective Monday the 20th. I strongly encourage anyone organizing such events, any such assemblies or concerts, to conduct them virtually. If they are held in person, visitors must provide proof of vaccination. These measures have a simple goal: to limit contact between students, especially those who haven't had a significant window of opportunity to be vaccinated at this time. For early learning and childcare, including after-school programs, children will be grouped, and these groups will not change more than once a week. At level 1, masks will be required for students 2 and over in all indoor areas of the facility, although they can be removed for those ages 3 to 5 when they're in their groupings together. Disinfecting requirements will remain in place, and visitors will be limited. The rapid test program for close contacts will remain in place at levels 1 and 2, but regular rapid testing, to be clear, given the different types, may be required for attendance at level 3. This is a lot of information. Schools are going to be sending out communications directly to families later today and include links to our website where the plan is available. You'll see documents like this, which are fairly clear, different age groups at the top, 0 to 5, high school, etc. So it should be reasonably straightforward to find the information. And if you have any questions, as always, don't hesitate to contact either folks at your children's school or the department will be happy to help. Les plans complets sont disponibles sur le site web des écoles saines et sécuritaires. Je vous encourage à bien les lire et à vous renseigner car ces plans sont très détaillés. J'ai déjà montré ici, on a les pages d'informations spécifiques pour chaque niveau. Et si vous avez les questions, n'hésitez pas de contacter les directions à l'école ou lance-moi un courriel au ministère. Je peux toujours être contacté à dominic.cardy@gmb.ca. Nous savons que les familles veulent se rassembler pendant la période des fêtes. Nous espérons que ces mesures permettront de garder nos élèves en bonne santé et en sécurité et surtout de limiter la propagation du COVID-19 à l'approche de ce temps de réjouissance. There have been an enormous number of changes over the last 2 years. It has not been easy on children, on school staff, or on their families. But after 2 years, we know what we need to do to keep ourselves and the vulnerable portions of our population as safe as possible. We know that when we follow these rules and follow them properly, use our masks properly, stay home when we're sick, get tested, wash our hands, all of these measures contribute to safe schools. And we're counting on communities to do their part to help keep schools open. We've tried, wherever possible, to keep our students in the classroom. It's the best learning environment, and it also allows them to keep accessing the services at school that they need to succeed. Educational assistance, food security programs, and mental health services. There are so many students across this province who count on those services every single day. And we need your help to ensure we can continue to provide them. And the only way that's possible is if we recognize that regardless of what I say, what Minister Shephard says, what the Premier says, what Dr. Russell says, after 2 years, we all have a general understanding of what we need to do to keep ourselves and our community safe from COVID-19. So please do that. Not because it's the law, not because it's required, but because it's the right thing to do, and it'll make life easier for all of us. It'll make it easier for us to continue with education, and it'll make sure that our hospital system remains open for all of us when we need it. I want to thank all of the teachers who have been under huge stress throughout this process, dealing with often rapidly changing situations and changing rules. Same with our early childhood educators, who were there for the province right at the beginning of the pandemic and are still there today, having to adjust as we adjust to try and do what we can to keep the province safe. So I want to thank all of those folks and the people who work in the departments as well. And if this is the last chance I have an opportunity like this to wish everyone a safe and Merry Christmas and Happy Holidays. And let us hope that 2022 is a brighter year. Sans les efforts soutenus de nos enseignants, éducatrices de la petite enfance, de personnel administratif et de soutien, tels que les chauffeurs, les concierges, nous ne serions pas en mesure de gérer les éclosions et de réagir à intervenir adéquatement à ces situations qui évoluent rapidement. Il faut souligner le travail remarquable accompli par les infirmières et infirmiers des bureaux régionaux de la santé publique. Ils consacrent de longues heures et font des sacrifices personnels pour assurer la sécurité des écoles publiques et des garderies éducatives dans notre province. Merci. So families, please stay safe, make healthy choices for yourself and for others in the coming weeks, and please participate in always festive rapid testing services offered through our schools and public health. Those test kits sent home with students this week. Parents, please check your kids' backpacks, keep one test, check your child on January 9th before they return to school. And finally, I want to really encourage any parents of children in that 5 to 11 age group, please get your kids vaccinated. Make an appointment, even if there's a bit of a delay. Make the appointment today, get the shot as soon as possible. En terminant, j'encourage tous les parents qui n'ont pas encore pris rendez-vous pour faire vacciner leurs enfants à 5 à 11 ans, de la faire durant les prochaines semaines. C'est très important. Je vous remercie tout le monde. Je vous souhaite de bonnes vacances d'hiver, de fêtes joyeuses et en sécurité. So again, have a great holiday and stay safe.
Good afternoon, bonjour. The arrival of the Omicron variant of COVID-19 in New Brunswick means that we all need to take precautions to protect ourselves, our families, and our community. Young children in particular need our protection, not just because they are young, but because most of them are not yet fully vaccinated, although the number of partially vaccinated children is growing daily. As of today, 31% of those between the ages of 5 and 11 have received their first dose of COVID-19 vaccine, and another 17,000 have appointments scheduled. As Minister Cardy has explained, when the school term resumes in January, there will be a plan in place to monitor the impacts of COVID-19 on our schools and keep our kids as safe as possible. It hasn't been easy to keep schools open in this phase of the pandemic. Les enfants et les adolescents sont désormais le groupe le plus important parmi les nouvelles infections quotidiennes et il y était difficile de ralentir la propagation du virus dans ces groupes d'âge. Children and teens are now the largest group among daily new infections, and it has been a challenge to slow the spread of the infection in this age group. But it's very important for kids to be in school. We want to be sure there is an appropriate plan in place that will keep our kids healthy and safe while they learn. Public health has and will be an integral part of our government's plan to maintain safe and healthy schools. The arrival of the Omicron variant means we will see a continued rise in infections in the weeks ahead due to it being more contagious. So it is crucial everyone follow the public health measures in place. And I know some of those measures are not easy and they cause hardship. This has always been a balancing act and continues to be just that. We need to buy some time and slow the spread while children get vaccinated and boosters roll out to everyone. I've seen the lineup for booster clinics, and we know many are eager to get it. We are constantly working to find ways to add capacity and continue to ask for your patience. There is enough vaccine for all of those looking for it. It's being able to administer those doses as quickly as possible that we're working on. I want to thank those with the RHA clinics and our pharmacy partners who once again are doing their very best to protect all of us. Aujourd'hui, Santé publique annonce qu'il y a 60 nouveaux cases de COVID-19 au Nouveau-Brunswick. Today, Public Health is reporting 160 new cases of COVID-19 in New Brunswick. The highest numbers continue to be in the southern zones and the Miramichi. Earlier this afternoon, through the Dr. Georges L. Dumont Hospital Laboratory in Moncton, we've now confirmed results for another 11 Omicron variant cases in our province. This brings our number of confirmed Omicron cases to 14 in New Brunswick. However, seeing what is happening in jurisdictions around us, we know that there will be many more confirmed Omicron cases. With 70 recoveries, there are now 1,141 active cases across the province. To date, our healthcare system is managing this outbreak. There are now 42 New Brunswickers in hospital with COVID-19, of whom 14 are currently in ICU. But an increasing level of infections brings with it the rise in severe illness due to the virus. By all New Brunswickers working together, we can slow the spread of the disease and keep the number of hospitalized cases to a manageable level. The COVID-19 virus appears to be less severe in children than in other age groups, but children can and do become seriously ill and require hospital treatment. Even when their symptoms are mild, children can pass the virus to others, particularly the elderly whose immune systems may not be able to provide a full defense against its effects. That is why we are initiating a holiday testing blitz for all school children in every region of the province. All New Brunswick school children from kindergarten to grade 12 will be provided with rapid point-of-care testing kits to use at home over the holidays. Students in grades K to 6 will receive 2 kits containing 5 tests per kit. Students in grades 7 to 12 will be given 1 rapid test kit. This will enable children and teens to do rapid testing every 2 to 3 days over the holiday break. These tests will help us quickly identify new infections and slow the spread. Rapid testing provides an additional layer of protection for our kids. Combined with getting vaccinated for COVID-19, wearing masks in public settings, washing hands frequently, keeping one's contacts low and constant, and monitoring for symptoms, this measure will help reduce the spread of the virus. I ask all parents to watch their children for symptoms of COVID-19 during the holidays. And if symptoms appear or if a rapid test result is positive, please isolate immediately and book a COVID-19 PCR test. Should families wish to test more often or to include other household members in the rapid testing process, additional kits may be obtained at a Horizon or Vitalite distribution center. This is a magical time of year for everyone, but especially for children. I want everyone to enjoy the Christmas holidays and experience the joy that this season brings each year. But I want everyone to do this safely in a way that limits the spread of COVID-19 virus. I hope the measures we are announcing today and the plan for safe return of students to our schools in the new year will give families some comfort as we enter the holiday season. If we share in the true spirit of Christmas with kindness, consideration, and hope, we can all have a joyous holiday season while protecting our communities and keeping everyone safe. Merci beaucoup et joyeux fêtes. Thank you very much and happy holidays.
Thank you, Ministers Cardy and Shephard. Merci beaucoup, Ministre Shephard et Ministre Cardy. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up. You have the right to pose your question in the official language of your choice. Andrew Waugh, Brunswick News.
Thanks, Bruce. It doesn't matter to me who speaks to this. I'm trying to reconcile Minister Shephard's comments about how dangerous Omicron is. And Minister Shephard, you talked about in the legislature how early studies indicate that children can get very sick and die from the Omicron variant. And the decision to keep high school open for the majority of next week, grades 7 and 8 open until Tuesday. Why not just close down on Friday for everyone?
So I'm just going to start, Andrew, and just clarify that I believe what I spoke in the legislature was to the fact that Omicron shows an increased risk of children being hospitalized. I'll get Minister Cardy to follow up.
Thanks, Andrew. Of course, Omicron presents a risk, and we're seeing increasingly the scientific evidence that's coming in shows that it is an increased risk to young people. Vaccination appears to provide some protection despite issues around vaccine escape and a loss of effectivity that we're seeing regardless of the new variant. Again, the choice here is between what I think is the least worst choice, which is a plan to try and maintain safety protocols in schools that allow them to stay open until the point that public health says that they have to close, or between preemptively saying that we would simply shut schools down and potentially have an indefinite closure. Something that I've certainly thought a lot about over the last 2 years as we've looked at the different models of how to provide education throughout the pandemic is the limitations around online learning, the social isolation it causes, the damage to the mental health of students who are not able to access services in schools that they need, kids with special needs, kids who rely on schools for food. So the goal with this plan to manage a public education system is to keep public education running as long as we possibly can under a situation that is as difficult as it can be while still being safe in the eyes of public health. And I hope that over the last 2 years I've shown a level of consistency in terms of pushing for measures that are as strict as they possibly can be. These measures offer us a degree of protection that allows schools to stay open. If contact with the virus, either Omicron or some new variant, shows that we need to further tighten and still keep schools open, if there's some way to do that, we'll look at doing that too. But this is a balance between what I know that some parents would like, which is seeing schools shut right now and for as long as possible, and others who continually email me and say, why do our kids have to wear any masks and let's just let this go? My job is not to listen to public opinion on this, but to try and listen as much as I can to the evidence and to the experts. And this plan was drafted in that line in consultation with the folks from public health. And I think it's a plan that will survive contact with our opponent, the virus, come January, But again, we won't hesitate to make adaptations as necessary. I hope that answers your question.
Thank you. Thank you, Ministers. Mr. Waugh, do you have a follow-up?
I do. Thanks, Bruce. So given that this is all based on science and evidence and stuff, and perhaps I missed it, there was a lot of information given out just now. Will these rapid testing rules extend to all school staff, bus drivers, teachers, janitorial staff, and if not, why not?
So on the staff side, we are absolutely first encouraging all adults, as I've said before. I mean, part of the thing I find frustrating with this, you do not need to wait to be told by your government that it's a good idea to go and get a rapid test. And we have an expectation that citizens who are adults are going to do what they need to do to make sure they protect themselves and their families. And we are going to provide those kits to the students to make absolutely sure that there's no issue, for example, with poor kids who can't afford to buy the kits. But for the adults, there's an expectation they're going to be contributing to this responsibility themselves. We will absolutely, if we end up by having people who are identified as a contact of a case, then we step in to try and manage the situation and provide tests. But the day-to-day tests that people are taking on a preventative basis, they're cheap, they're easily available, and at this point plentiful. Get a box, use them.
Thank you both. Vicky Hogarth with CHCO TV.
Thank you, Bruce. My question is either for Minister Cardy or Minister Shephard. And as you mentioned, the 0 to 9 age group has the most number of positive cases right now in New Brunswick. So where are studies right now and trials for the 0 to 5 age group in terms of vaccines? Are we likely to see an approval of the vaccine for that age group in weeks ahead or months ahead? And does the current rate of vaccinations in the 10 to 19-year-old age group look promising?
Well, I think that's a Dr. Russell question, and she's not with us this afternoon. So I know that there's very early data that's still being analyzed, and I would expect that in the coming several weeks, early months, we'll be able to get some more news from that.
Ms. Hogarth, do you have a follow-up?
I do. Based on what happened after the holidays last year, are we doing modeling for what might happen, given that sort of a similar scenario, but that coupled with the Omicron variant, and are we prepared to close schools?
We're facing again a new variant which appears to be many times more infectious than the Delta variant was, which is already more infectious than the variant that we were dealing with last year. So modeling is always difficult in those circumstances. Taking as many preventive actions as we can is why we have this plan with a detailed list of new restrictions that we're putting in place. But again, absolutely, if we see from public health that there's a concern that schools are a source of spread that has to be stopped and controlled, we won't hesitate to move schools online. And that's always been our intention, really, regardless of which variant we're facing, and it'll apply equally in January as it has throughout this year and the year before.
I'm just going to add to what Minister Cardy said. We're learning really quick that 2 weeks is a long time. So when school breaks for the summer, or when school breaks for the Christmas break, we're going to have several days to see how this evolves. And we have always said that we will pivot, we will adjust, we will make changes as we need to respond to the current times.
Thank you. Thank you both. Thank you, Ms. Hogarth. We're going to go to Natalie Sturgeon with Global TV.
Thanks, Bruce. I'm just wondering, Minister Cardy, obviously no matter sort of what rules you put in place, there will be parents who will not send their children to school given the current situation. Will that be monitored and tracked, and will there be penalties for not sending their children to school in the current circumstances?
It's actually one of the issues that I think I've mentioned previously about work on the green paper, which seems like it was discussed in some long ago before times. But all of the items in the green paper, we've achieved really good results in. 70% of the things in the green paper have actually been completed. The only thing where we have not had movement has been on dealing with absenteeism. And that's been partly because of the difficulty of collecting the sort of information you're talking about and imposing it during a time of pandemic. That we recognize the challenges that this illness is posing for families, that if you have parents who are sick, kids who are sick, there's lots of absenteeism for reasons both, I would argue, reasonable and unreasonable. But that's certainly not our intention to go and penalize families at this point. But we do have to recognize here that because I've had people saying again, why only the K to 6 finishing school this week? Why not 7 and 8? Because those kids can be vaccinated. If they're not, it's because of their choice or their parents. And we have got to do, as a public education system, we've got a responsibility to try and keep schools open and keep learning going as much as possible under as many circumstances as possible. So the closures next week to allow for the switch to some of the measures that I've laid out today, will give the school system some time to prepare for January. Similarly, I'd ask parents to prepare for January as well, using the test kits that we're sending home, taking other steps to make sure that they and their families are safe. As we continue to grind through this pandemic, if we start to see that we have a serious problem with absenteeism on a broad scale, we'll absolutely look at what we can do there. But we have got to make this a discussion between citizens. Minister Shephard's got a family she wants to go home to for Christmas, spend time with. All of us want to spend time with people we love, try and relax. We want to try and have as normal a life as possible after Christmas. It's going to depend on our actions as citizens on whether or not that's possible. And so the fear and the stress that causes parents to say, well, I think I'll keep my kids home. We can all play a part in helping to reduce that by doing our part to try and stop the spread of this disease, especially with the level of anxiety that Omicron is understandably bringing to the population. So if we all play our part, we can get through this much more easily.
Thank you. Ms. Sturgeon, do you have a follow-up?
Yes, it's for Minister Shephard if she has this information. I'm sort of wondering what zones the Omicron cases are in, and if we know how many other people may be self-isolating as a result of exposures from those 14 confirmed cases.
I don't have the zones because we actually just got confirmation at 1 o'clock. So that I'm sure our epidemiological team is pulling that together for us, and I'd likely have that for you tomorrow.
Thank you. We're now going to go to Laura Brown with CTV.
Minister Shephard, I'm also going to follow up. I'm wondering if you happen to know then what the status is of the 14 with Omicron, like how they're doing, and if any of them are under the age of 19.
No, I'm sorry, Laura. I don't have that information with me here either. We can try to follow up for you.
Okay, Minister Cardy, and this is probably something that we've asked before, but I'm wondering how you enforce rapid testing, because obviously they do it at home. So how do you know that children and parents are doing it?
It comes back again to hoping that folks are going to act as citizens and be responsible. We know that some people won't. We know that some people won't tell the truth. That's just humans being humans. But the point of the rapid testing at this point, this is not contact tracing. This is trying to get a snapshot of where the disease is hitting the population. And so the best way to do that is to have as many people as possible use those tests. And we are relying on people the same way as we rely on people to do the other things the school system asks of them, in the same way we rely on people as citizens to behave, to get their driver's license renewed, not to come up with a fake one, to pay their taxes on time. We know that the enormous majority of people will do that because they know it's the right thing to do. The tests are, one of the things I should mention, the tests are easy to administer. We've had some folks who've been in touch and saying they're really concerned because their kids had one of the more invasive nasal swab tests and they found it really difficult. The tests we're talking about here are really like just putting a Q-tip just into your nose a little bit. They're not stressful. They're easy, simple to use. The results come in 15 minutes. It's a little test kit that looks like a birth control, a pregnancy test rather. Very, very, very simple. If you can read one line or two lines, you can use the test. So these tests are free for the schools, easy to use, and our best front line of defense against COVID and the spread of Omicron right now.
Thank you, ministers. Thank you, Ms. Brown. David Caron avec l'Acadie Nouvelle.
Oui, j'ai juste une question. Fait que la docteure Shephard, la docteure Russell a toujours maintenu que la donnée importante, c'est les hospitalisations. Et puis quand je regarde, la tendance est toujours à la baisse. Donc, si, admettons, là, il s'avère que dans 2 semaines, Omicron, ça a fait plus de peur que de mal. Est-ce que tous ces règlements qu'on vient d'annoncer dans les écoles, est-ce que ça pourrait être assujetti à des modifications, à des assouplissements?
I'll start, and then maybe Minister Cardy can follow up and help me if I've left out some details. If I think back to March of 2020, when we shut the province down, many people thought we were overreacting. And we knew that keeping COVID out of our province was our best defense. At this time, COVID-19 and its variants, in particularly now Omicron, is here. And so now we are racing to get our pediatric doses completed and to get our third dose boosters completed, because we know that with the third dose against Omicron, the efficacy of the 2 earlier shots increases back up to over 90%. And that's great. That's what we need to protect individuals from serious illness, hospitalization, and death. So to the latter part of your question, yes, we'll always be assessing as our period of time goes by. And the Christmas holiday break, especially from school, gives us a little bit of runway to see what might be happening in our near future. But we see in other provinces, I see that Nova Scotia has just announced 178 cases today. So we see in our surrounding provinces and the state of Maine, cases going very high. We probably can predict that that's going to happen here in New Brunswick as well.
To build on Minister Shephard's point, we're dealing here with a disease, a variant of the disease that appeared really around a month ago and is already becoming dominant in country after country after country. And I believe it was the WHO today who said they've never seen a spread like this, that it's appearing in nearly all countries nearly simultaneously. So we're sitting here having to make plans for a disease that is nearly brand new, a variant that's nearly brand new. We do not know yet exactly how it works. We don't yet know exactly how infectious it is, and we don't know exactly yet how dangerous or fatal it's going to be. We have extremely strong indications that it is much, much more transmissible. And we have got preliminary scientific data that it's more dangerous for young people. So on those grounds, we are putting these measures in place. And absolutely, if after Christmas it turns out that this is all fine and we actually didn't have to worry very much and we can relax restrictions, that has been the point all the way along. It's something that I find difficult when we talk about government plans evolving. These aren't flip-flops or reversals. They're an adaptation to the situation as we see them. Last summer, we had no COVID-19. Opening our province was entirely appropriate. This fall, we tightened down again. Now we're having to tighten down further because of an entirely new variant. These changes are going to continue to happen. They are nothing that anyone in government wants. They're nothing that anyone in this province wants. But the consequence of inaction or sticking with outdated plans would be our hospital system crashing and New Brunswickers dying. And that's not something that anyone around the cabinet table is willing to accept.
Merci. Monsieur Caron, as-tu une suivi?
Oui, parce que, oui. La question est juste parce que je sais que c'est une inquiétude de beaucoup de gens avant le temps des fêtes qui est dans quelques jours. Est-ce que des fermetures des frontières provinciales est envisagée ou pas pour le moment?
For now, we're sticking with our plan that we have. We're at level 1 with interim and bridging measures to see how our next few days are going. We are hopeful that families will be able to have their Christmas and we'll be assessing on a very daily basis. Every single day, our epidemiological team is analyzing our data. So I think it's really important to know that that's the message we need New Brunswickers to hear from us is that we can have a safe Christmas. We need to get vaccinated. We need to wear our masks in public. We need to keep our contacts low and consistent. And we need, to stay home if we show any symptoms of COVID-19 or even colds, because those are very similar. So don't take the risk. Keep everyone safe. Look after yourself and your families.
Daniel, mille excuses de ne pas répondre en français. Je vais juste donner brièvement une réponse aux deux questions. C'était pour le premier encore, c'est vraiment, on a fait les adaptations au plan aujourd'hui en vue d'adapter au Omicron, parce que c'est clair que c'est une variante qui est beaucoup plus infectieuse que le Delta ou les autres variantes de COVID. Et aussi, on a assez d'évidence maintenant, même si c'est préliminaire, que ça pose un risque pour les jeunes. On a besoin de prendre d'action pour pousser contre une variante comme ça. Alors, on voit que Omicron est en train de remplacer le Delta, qui était jusqu'à quelques semaines passées le pire qu'on peut imaginer. Maintenant, on a Omicron qui remplace le Delta dans pas les mois, pas les semaines, mais dans les jours. On voit dans le Royaume-Uni que les rapports que le système de santé national, un système de santé qui est quelque chose de vraiment bien résourcé, et c'est beaucoup d'infrastructures dans le Royaume-Uni, clairement, et il dit que leur système de santé est au bout du gouffre, bord du gouffre. C'est quelque chose qu'on a besoin de prendre comme sérieux. Et aussi le fait que l'Omicron, ce n'est pas quelque chose qui va prendre les mois, les semaines d'arriver ici. L'Organisation de santé mondiale a dit que Omicron est en train d'apparaître dans presque tous les pays à la même temps. C'est clair que c'est quelque chose qui va nous frapper fort pendant les fêtes. Et comme ministre Shephard a dit, on a eu le choix cette Noël. On peut, si on veut, réduire nos contacts. Ça va avoir un impact positif. On peut, si on veut, ignorer ces avis. Mais le résultat va être les éclosions. Le résultat va être les gens qui vont devenir malades et les gens vont mourir pour aucune raison. Alors, oui, nous sommes prêts pour regarder encore les mesures en janvier et j'espère sincèrement que je suis complètement sur la mauvaise page, que Omicron va être quelque chose qui n'est pas si pire que tout ça, mais on a besoin de suivre l'évidence et l'évidence qu'on a besoin de prendre d'action et on a besoin de prendre l'action dès qu'aujourd'hui. Ceci est une position encore un peu comme mars de 2020. À ce point, c'était on ne connaît pas beaucoup de tous les détails du COVID-19. Maintenant, on connaît beaucoup plus. Alors, on a beaucoup des outils qu'on peut utiliser. Les vaccinations, toutes les mesures de santé. On a besoin de les utiliser et ça, c'est un choix pour chaque citoyen et citoyenne.
Parfait. Merci. We'll now go to Bobby Jean McKinnon with CBC.
Yes, hello. Can you hear me okay?
Yes, thank you.
Thank you. Minister Shephard, the province's goal has been to get 90% of the total population double dosed. I'm wondering if or how Omicron changes that.
So we've always strived to get as many people as possible to get vaccinated. And I believe earlier conversations indicated that if we got to 90%, we might have some normalcy back. But in understanding how this variant works, we now know that even vaccinated, you can contract COVID-19. We know that the variant can break through at an earlier time than the 2 doses, and that's why the booster is so important. The data that Public Health shared with me is that when it comes to Omicron, your 2 doses at about the 6-month gives you about a 30 to 35% efficacy. But with your 3rd dose, 7 days post, you are back to a 90% efficacy. And that's where we need to be with regards to helping to prevent the contracting of COVID and then helping to not transmit it. So it is a numbers game somewhat, but Omicron does change the water on the beans because it's 30% more transmissible than Delta. Omicron is to Delta what Delta was to the original COVID. And so this is the changing elements that we're always going to be dealing with for a while.
And do you have a follow-up?
I do. Can I just ask one quick clarification? You, Minister Shephard, and Dr. Russell have referred to it as being 30% more transmissible, but we've also heard federal officials refer to it as 3 times more transmissible.
So I can ask Dr. Russell to confirm and clarify that with us. I've been given the 30% number on a couple of occasions, so we just know that it's going to kick our butt.
Okay, fair enough. Also, you've stressed the importance of everyone getting fully vaccinated and getting their boosters as quickly as possible. It looks like there's no RHA vaccination clinics scheduled over the holidays from the 24th to the 27th. Will more clinics be added over those 4 days?
We're going to put in as many clinics as we can staff. And the 24th to the 27th, I don't have any confirmations on that today either, but certainly if we are able to produce them, I know that the RHAs would want to. I know our pharmacists are certainly assisting, and we will, it is important that we do as many as possible, and that's why we're opening up the mass clinics to give people as much opportunity as possible.
Thank you both. Jordan Gill with CBC.
Yes, this question is for Mr. Shephard. The province has repeatedly described the cases linked to the hospital outbreaks as exhibiting mild to moderate symptoms. How does the province define mild to moderate?
That's a clinical question, and I would be much more comfortable with us getting you an answer to that from our medical staff.
Mr. Gill, do you have a follow-up?
Yes, and this is for Mr. Cardy. We've heard teachers will not be told if there's a positive case in their class. Is this true? And if so, shouldn't the province, as their employer, be providing them with the most information possible to keep themselves safe?
I am not aware of that, so let me check and get back to you. But that is, we have very, very strict privacy requirements in New Brunswick, but certainly nothing that would go to that level to the best of my knowledge. We'll get you a detailed answer as quick as possible.
There would be contact tracing.
Yeah.
So I would think that there has to be some communication.
Yeah, I mean, we certainly, waiting for the cameras to come back. We have certainly had multiple cases where I am absolutely aware that people in the school have been notified about specific cases, not just in a classroom, but in a school. So that's obviously an important part of managing the outbreaks. So again, I don't want to give anything definitive if you've heard that elsewhere, but certainly I do not understand that to be the case.
Thank you both. Maintenant, on va procéder avec Alex Villeneuve avec Radio-Canada.
Oui, bonjour. Vous l'avez dit en anglais, mais j'aimerais juste vous entendre en français. Est-ce qu'on peut résumer rapidement ce qui va changer pour un élève dans son école après ces mesures-là?
Alex, peux-tu parler plus fort, s'il vous plaît?
Oui, est-ce qu'on peut résumer en français ce qui va changer pour un élève dans son école? C'est quoi les nouvelles mesures qu'il va devoir...
Peut-être que je peux faire ça offline après, parce que ça c'est une assez longue discours, parce que tous les éléments sont dans un discours de 18 pages, alors de relire 9 pages, ça va être probablement créer un problème. Mais après, on peut entrer en contact une sur un, OK?
OK, ben, dans ce cas, quels sont les déclencheurs qui vont faire passer une école d'un niveau d'alerte à l'autre?
Okay.
Monsieur Villeneuve, peux-tu approcher ton micro?
Oui, quels sont les déclencheurs qui vont faire passer une école d'un niveau d'alerte à l'autre?
OK. Ça, c'est une question qui est liée entre le ministère de la Santé et le ministère de l'Éducation. On va prendre, à notre avis, du santé publique. S'il dit que c'est une question que, OK, on a besoin de fermer une école, on ferme l'école. Si on a besoin de fermer une famille des écoles dans une communauté, on va prendre cette action. Si on dit qu'on a besoin de fermer toute l'école dans la province, ça, c'est qu'est-ce qu'on va faire. On entend d'avis. On va écouter l'avis de santé publique. C'est ça qui est la collaboration entre santé publique et le ministère de l'Éducation et de la développement de la petite enfance. Je trouve ça quelque chose qui était vraiment contribué aux stabilités de notre système pendant les dernières 2 années, malgré tous les défis et problèmes que tout le monde a survécu. Et on va continuer dans la même direction. Si Santé publique dit qu'on ferme une école, on ferme l'école.
Et est-ce qu'il y a une grille d'analyse comme du moment qu'on atteint un certain niveau de COVID, on ferme ou on passe à une phase de plus? Est-ce qu'il y a une grille d'analyse comme ça?
Encore le problème qu'on a aujourd'hui avec Omicron, parce que les détails ne sont pas encore concrétisés avec le taux le niveau d'infectivité, etc. On connaît que c'est encore que, comme ministre Shephard a dit, c'est pire que Delta, c'est beaucoup pire, ça va nous frapper fort, mais on attend pour les médecins, les experts aux santé publique, quand ils ont l'évidence qu'ils en ont besoin, ils peuvent nous dire, OK, c'est nécessaire maintenant de mettre en place une journée opérationnelle, c'est essentiel maintenant de fermer une école pour un bout de temps. Quand on connaît plus de détails, ce serait possible de mettre en place les déclencheurs plus traditionnels, mais aujourd'hui, on a besoin d'être clair que c'est un ennemi on ne lui connaît pas beaucoup encore. On connaît ses cousins, mais Omicron, on a besoin encore de lui analyser un peu avant qu'on peut découvrir la manière plus efficace de lui combattre.
Merci beaucoup, M. Villeneuve. Merci, Ministre Cardy. Merci, Minister Shephard. Thank you, Mr. Shephard. Thank you, Mr. Cardy. That concludes today's update news conference. Merci beaucoup. Voilà la fin de notre conférence de presse et mise à jour. Merci beaucoup.